Hello and welcome, everyone. Thank you so much for joining us for this walk and learn session today. We're very excited to have you here as we near the end of the 7-week journey towards better health, stronger community, and meaningful conversation. For this session, if you're able to, we do encourage you to stay active while you listen. So that can be a quick stroll within the office, a walk within your neighborhood, or a simple stretch of your legs. This series is all about movement, mindfulness, and learning together. My name is Afi Kole, pronouns she, her. I am an incoming second-year medical student at Rush Medical College, and I'm also working with the Health Equity Office to help evaluate the impact of this walking program through the wellness surveys. So thank you in advance for being a part of that effort as well. I am very excited to introduce today's speaker, Dr. Daniel Luger. He is a non-invasive cardiologist specializing in echocardiography, advanced lipidology, and prevention. Dr. Luger is opening a new heart health clinic at the Rush Oak Park Hospital that will bring together experts from different disciplines to help patients prevent heart disease. And in his spare time for exercise, he does enjoy playing tennis. So if we can give a warm welcome to Dr. Luger, and I'll have him take it away.
Thank you so much for having me. I was asked to talk about the impact that psychosocial stress has on the heart. And I think in order to really fully understand kind of the impact that it has on the heart, I want to describe what we care about for cardiovascular health. What is atherosclerosis, what is cardiovascular disease, and kind of actually go into the specifics of what we mean by cardiovascular disease, and then talk about how that relates to psychosocial stress and how psychosocial stress can contribute to the generation of cardiovascular disease. But also the opposite is true in that tending to your mental health, staying physically active, how that can reduce the risk of cardiovascular disease. And I would say every talk that I give that's related to cardiovascular prevention starts with 80% of cardiovascular disease is preventable. We have the tools to detect disease early. We have the preventive strategies that with both medicine and lifestyle modifications can help reduce the risk of and progression of cardiovascular disease. So this is a very formidable topic, and it also has a ton of bang for its buck, let's say. The process of atherosclerosis, that is a fancy doctor way of saying gunk buildup in the pipes. That is what we talk about when we have heart attacks, strokes, a lot of dementia, kidney problems. That's all related to the progressive reduction in blood flow to your vital organs. And that is all caused by plaque buildup in the arteries themselves. There's the lining of the blood vessel wall. We call that the endothelium. And that is essentially the barrier from the inside of the blood vessel to the wall of the blood vessel itself. And the reason I'm focusing on this particular zone is because this is actually very important in terms of the generation of atherosclerosis. It's this lining of the artery that protects your artery walls from that gunk buildup. And the converse is true in that whatever insults the integrity of the lining of the blood vessel will set you up for plaque buildup and eventually put you at higher risk for heart attacks and strokes in the future. So the question is, what does lead to insult or injury to the blood vessel lining? The most common things that we think of are hypertension, high blood pressure, where you would never feel it. You don't feel that most of the time you don't feel your blood pressure is 140 over 90. But what's happening at the level of the artery is that there's stress hitting the walls of the arteries, wearing down the lining of that artery wall and allowing for cholesterol to then penetrate into the wall of the artery. Other things like glycosylation, or a fancy way of saying like sugar buildup on the wall, that allows for more cholesterol to, again, penetrate into that wall of the artery. Other things like tobacco use, environmental exposures, toxins, all that stuff can wear down the lining of the artery and, once again, ultimately lead to cholesterol that's in circulation depositing into the wall of the artery, gunk buildup inside the wall of the artery. And this process actually takes years, decades to actually unfold and manifest. And so we can actually identify when this process is happening at a very early stage with something called a coronary calcium score. So we can take a snapshot of the arteries, see if there's any plaque or calcium built up, and say, hey, you have the beginning signs of plaque development. We can actually halt that process in its tracks and at least prevent any further progression of it and any manifestation of disease. What we know, like, and as lay people know, is like what, having a heart attack. What ends up happening is this plaque that builds up in the wall of the artery, it ultimately ruptures or pops open. And in a full-blown heart attack where you're crushing chest pain, you're sweating, you have to go emergently to the hospital. This is where there's a full rupture of a plaque in the wall of the artery and a complete blockage of blood flow in the arteries in the coronary arteries. So these are arteries that are on top of the heart that are providing blood flow to the heart muscle itself. This same process can happen in the brain, and that's what a stroke is. So everything we talk about in the realm of cardiovascular prevention is about maintaining the integrity of the lining of the blood vessels and really working to reduce any of the risk factors that perpetuate atherosclerosis or plaque buildup. And if we do find plaque, the goal is to stabilize that with combination of medications and lifestyle modifications. So where does that all fit into stress and quality of life and lifestyle? So basically, psychosocial stress is what vital exhaustion is. That's loneliness, depression, it's composite anxiety. So that score, the highest quartile of vital exhaustion, was correlated with a 2.4-fold increase in cardiovascular events. So that is to say that if you are at the highest levels of disillusionment, loneliness, just feeling fed up, you're at a much, much higher risk of having a cardiovascular event. And having higher levels of exhaustion, depression, stress is actually a greater association with cardiovascular events than high blood pressure, cholesterol, smoking, diabetes. I mean, these are the common risk factors that we really often associate with cardiovascular disease. And yet, depression, anxiety, that composite score, that actually outpaces all these other risk factors in terms of predicting cardiovascular events. So this has kind of led us to a field in cardiology that is growing, which is kind of what we call behavioral cardiology, which looks at the link between psychosocial stress and cardiovascular outcomes. And there's a lot of interconnectedness between the brain and the heart, both on a physiologic level and on a behavioral level. So I'll kind of discuss briefly those two different pathways. One is, I think, a more intuitive one, which is people that are more depressed, people that are disengaged, disillusioned, and hedonic, meaning they don't want to, they don't have the same motivation to do things. They are much more likely to engage in unhealthy behaviors. So those unhealthy behaviors include bad lifestyle choices. I don't want to say bad as like there's a moral judgment, but unhealthy foods, inactivity, more likely to engage in tobacco use, alcohol use, drug use, and they're often less likely to follow up with their physician and less likely to take their medications as prescribed. So these are like kind of like the indirect links that I think that's intuitive and that makes sense. And really all those behavioral factors contribute to the cardiovascular risk factors that put stress on the arteries. So patients that, let's say, are obese and because they're depressed and disillusioned and disengaged, they're more likely to eat unhealthy, eat their feelings. I know I'm guilty of eating my feelings sometimes. And so people that are suffering from obesity, they have higher levels of systemic inflammation. They have higher blood pressure. They have higher cholesterol. They have higher sugars. So all these behavioral mediators are driving risk factors that ultimately lead to cardiovascular disease. And then the biological links, I think, are less intuitive, or at least less discussed and less not I would say not fully elucidated, which is when you're in a fight or flight state, or when you're in a chronic stress state, you are undergoing chronic autonomic dysregulation or dysfunction. So your sympathetic nervous system, this is your animal brain, you're trained to, run away from a tiger, the fight or flight. But if you're in a constant state of fight or flight, you'll have a sympathetic surge. So your blood pressure will be higher. You'll have hormones that are bombarding your blood vessels to clamp down. Your heart rate is higher. There's an association between chronic stress and chronic inflammation. So they've actually done studies where they measure the inflammatory markers, circulating inflammatory markers in the bloodstream, and people that have higher levels of reported chronic stress have higher levels of chronic inflammation. And there's a direct link between inflammation and atherosclerosis. That whole process, plaque building in the artery wall, that is a cycle of inflammation that drives that. So people that are inflamed have much higher risk of cardiovascular disease and cardiovascular events like strokes and heart attacks. Then there's also this, I think a little bit less clear, but there's evidence that there's endothelial dysfunction. So that lining of the artery walls that become the barrier function is less intact, and there's increased risk of atherosclerosis from that. And then also this circulating neurohormones, and there's a kind of a milieu that makes your platelets more sticky potentially, and in swings in serotonin levels. So there's a lot of different biological factors that contribute to both directly to the cardiovascular system, but also perpetuation of risk factors that drive cardiovascular disease. So overall, I mean, there is a very clear link now between mental health and cardiovascular health. And the question is like, really, what do we do about that? The American Heart Association has put out is the Life's Essential 8. This is the recommendations for a healthy living that reduce your risk of cardiovascular disease. That when I started the talk saying 80% of cardiovascular disease is preventable, this is how you get there, by addressing cholesterol, nutrition, sugars, exercise, sleep, avoiding toxic substances. What the American Heart Association has done now is wrapped Life's Essential 8 into two different things. One is your psychological health, and then also your social determinants of health, which are directly intertwined with your psychological health. But this is looking at essentially all the Life's Essential 8, these like fundamental, well understood risk factors, has to be interpreted through the lens of your social construct as well as the psychological health. The patients that I see in clinic, oftentimes, my first question is like, what brings you in? Like, what do you want for your health? And oftentimes it ends up veering into, what is it like at home? What is your environment like? Who's at home? Who are you cooking for? Who's cooking for you? Do you have support at home? How do you feel on a day-to-day basis? Like all of these, this is like application of cardiac risk factors in the real setting, in real life. And so what American Heart Association is pushing for is really interpreting all these risk factors through the lens of mental health. And that's kind of intuitively how I practice. But I think it's important to have it in writing and have a structure that encourages other providers and patients to advocate for their mental health as it relates to cardiovascular health.
Yeah, absolutely. Thank you so much for that enlightening presentation. It did bring up a question that I wanted to ask you. I know that a really big stressor that was seen society-wide was the pandemic, and though we're a couple years removed from it, I wanted to ask if you could speak a little bit more on what exactly you ended up seeing in your patients those years following the pandemic, and whether or not, or more so, what have you been doing, or what have you been, I guess, coaching your patients through in terms of like mitigating the coping mechanisms that they took on during that pandemic to deal with everything?
For sure. I mean, that was like a stress test for the whole system and for all patients on an individual level. I think I actually was a fellow at the beginning of the pandemic and just started my practice like right as the pandemic was picking up. So it was an interesting time to start. But I would say for sure that what I noticed was just a disengagement, not only with the medical system, but also like society generally. Like people were more isolated, less likely to engage. But I mean, I think like getting plugged in with a cardiologist and starting to kind of unpack these risk factors is never too late. So I definitely encourage people that like were hunkering down during the pandemic, come on out. It's a good time to plug in.
We have a question from Sandra. She asks, how can we manage anxiety on the job without taking medication? And are blood pressure medication or blood pressure pills okay to take if it's high at work due to stress?
It's a good question. I mean, I would start, the first piece is I'm not an expert in treating anxiety and depression. I'm an expert in treating the cardiovascular disease that's associated with it. But that being said, there is such a lack of mental health like resources in the system globally, and so I end up doing like writing plenty of prescriptions for patients for antidepressants or anti-anxiety medications. I also spend a lot of time like kind of coaching on coping mechanisms and exercise as a stress relief. But I would say, as it relates to hypertension, blood pressure is an extremely dynamic number. It is actually physiologically appropriate for your blood pressure to swing up during work and come back down at home. I do not generally recommend that if people have high blood pressure at work, just based on that you should take a blood pressure pill. What I recommend instead is that you check your blood pressure first thing in the morning when you wake up, and again before dinner time or before bedtime. And the real proper way to check your blood pressure is you have to cycle the blood pressure cuff 3 times. First, you have to sit for 5 minutes, check your blood pressure, you wait a minute, check it again, you wait another minute, you check it again. So you're supposed to check it 3 times with each sitting, and you should have an empty bladder, your arms supported on the table, your feet flat on the ground, your back supported. So these are all like techniques to really remove all these kind of exogenous or external factors that contribute to high blood pressure. Once you remove all that, including the stress of the workplace, we want to see what is your actual baseline blood pressure. Because if we were to introduce blood pressure medications for when you're at work, when you go home and you're just chilling, your blood pressure is going to tank because you're normally at the 120, but at work, your colleague is chewing their salad too loud, or your boss is annoying you. So like that is appropriate to have high blood pressure. Then the treatment would be to find a new job, not necessarily give yourself like a ton of blood pressure medications. So that's all to say that, blood pressure is dynamic. It should go up when under stressful circumstances, and that doesn't necessarily mean you should be on blood pressure medication.
Okay, thank you for that. We do have a question in the chat from Natasha Barnett. They ask, in your opinion, who should see a cardiologist and what type of patients should be seen?
That's a really good question, and I think every cardiologist, most cardiologists would answer that differently. As a preventative cardiologist, as I really practice like with a focus on the factors that influence atherosclerosis, and I believe that I have something to offer almost really most people. Like primary care doctor, I do a lot of primary care. Like a lot of what I do for sure can be done by primary care doctors, but there's just not enough time for every primary care doctor to really dig into each risk factor. And I think that with my specialty in lipidology and atherosclerosis, that it's a particular lens that I think is very powerful for at least a one-time visit to assess what your cardiovascular risk is. So I would say anybody that's over 40 that has some like either like overweight and some smattering of risk factors, I would say that it's perfectly appropriate to see a preventative cardiologist. Surprisingly, there are a lot of different types of cardiologists. So if you go in to see like an electrophysiologist, like the electrician of the heart, and you're like, I'm here to talk about cholesterol, they'll tell you to get out of the office. They don't really care about cholesterol. So you have to be careful with who you plug in with. But if you want to come see me, I see everybody. And I think I have something to offer everybody.
Okay, we have another question from the chat from Stephanie Bailey. It is a long one, so excuse me. She says, hi, thank you, Dr. Luger, for highlighting the social determinants of health and the importance of people caring for themselves in ways that are quote unquote non-medical. I wanted to point out the stress of life in general right now and how much stress people are under. Rush Walk for Wellness is a good way many people take care of themselves. Do you have any tips that you have for daily achievable ways to lower stress that you can share with patients?
I'm still working on my stress, honestly. I'm open to any comments from the audience too. But I would say, I think going back to like the real like fundamental of like wellness and healthy living, it's about movement and it's about what you put in your body. So for sure, when you can carve out the time to exercise even a little bit, that has a huge impact not only on your mental health, but also on your cardiovascular risk. So I think that there's a misconception that people like are like, oh, I've been sitting on the couch for the past couple of years. I can't go out and start exercising, or I don't want to go to the gym and embarrass myself. First of all, I love embarrassing myself at the gym. Second of all, like you don't need to go and do a huge amount of like, high volume exercise. Going from sedentary to minimally active, just moving a little bit has a huge impact again on reducing your cardiac risk, but also on your mental health. And it's kind of like a positive snowball effect, where the more you move, the more you feel like moving, the better your mental health is, the more you're going to end up moving some more. So we, in our clinic, we really recommend like slow, steady progress and just kind of chipping away at it. And movement and exercise promotes better sleep, which promotes better mood, which promotes better energy levels during the day. So it's really just kind of like taking that first step and getting into some rhythm of exercising regularly. And then eating, like taking the time to prepare your meals is really, really challenging. Like all of this takes time. And so in a busy, like hectic schedule, I think it's not unreasonable for people like, I just don't have time to do this. But I'm a medical student advisor too. And so I tell my medical students, like, I don't care how busy you are, you need to carve out time to exercise and eat well, because you can sit in front of the books and try to study for hours and hours and hours, but like the best thing for your mental health, the best thing for your memory and your retention of facts is to just tend to your body and your soul and to move and eat well. And so, yeah, I mean, the process of eating, like cooking your own food and eating your own food, I really encourage people to, and again, I'm like so far from perfect with this, and I would never let any of you guys talk to my wife because she'll tell you how many bad habits I have. But the process of like cooking and like taking out time where you're not looking at your phone and you're like actually looking at the food, hearing the sound of the like chopping broccoli, and like trying to be like a mindfulness practice around preparing food, and then really eating nutritious whole, like really like whole foods and food you prepared for yourself. There's something very like healing, at least for me, for that, when I can find the time. But of course it's like it's so hard to consistently find the time, and that's another, I think, practice in mental health is being forgiving yourself for indiscretions, forgiving yourself for falling off and not trying to be perfect, and trying to just like kind of get back on the horse when you feel like you have the willpower to do it.
I would say the practice of giving yourself grace. That's something that I've had to even learn in the past couple of years. So thank you for that.
Let go of like all that criticism. But the same applies to like people that are like trying to lose weight or trying to be active. Like, you'll have your bad days, you'll have your bad months, but like there's always the opportunity to just kind of just step back out there and build up again.
You're dropping gems, Dr. Luger. We have another question from Anisha. She asked, why are South Asians at higher risk for cardiovascular disease? She's managed to keep her BP under 120 these past 5 years. The same can't be said of my family members and friends. So can you provide any more insight on that?
Yeah, I mean, it's so much of a risk factor being from South Asian, that it's like incorporated into the American Heart Association guidelines as like a risk enhancer. And so I think that there's a lot of factors that are not fully elucidated, but I think that there's certainly a genetic component to it. It's like the processing of cholesterol, the way your body clears cholesterol, the processing, like, there's all these genetic pieces that contribute to cardiovascular risks. I think we're going to learn a lot more about that in the next 2 to 5 years with AI. They're going to start telling us exactly why all these disease states are manifesting. I think also there's, like traditional diet in that part of the world. I don't presume to be an expert on that, but from my understanding is that there's a lot of saturated fat in some of those dietary patterns, and that also contributes to that milieu. But there are certain populations that we've seen that there's a propensity to having higher burden of cardiovascular risk factors, and for sure atherosclerosis is like on the top of that list. So for people that are of South Asian descent, we really recommend getting plugged in early with a cardiologist. Again, we can, let's say your father had a heart attack at 50. I would get your heart scanned at 40, and we can identify the early signs of plaque development and start medical therapy or, interventions that will prevent you from having the same fate. So even if the genetic predisposition is extremely troubling, there are ways to modify and bend that mortality curve and really reverse or at least prevent the disease from manifesting.
I do want to take a quick pivot to another question. Are there cardiovascular risk factors that women should be more aware of?
That's an interesting question. I would like kind of answer it in a slippery way and say that all the risk factors are really the same. Like the pathogenesis of atherosclerosis, the way that plaque develops is very similar. But what's unique about atherosclerosis in women is actually there's a pathophysiologic explanation, but there's this like kind of yellow gunk underneath the endothelial lining. So that is actually the fibrous cap. So women tend to have thicker fibrous caps, meaning that there's like actual like thickness to the plaque that develops in the artery wall, and that actually protects it from a full-blown rupture like you see in men. And it's really women more commonly present with erosion of plaques, so what we call, they're not full-blown heart attacks. Some in like layman's terms is like mini heart attack or mild heart attack. In medical terminology, we call it an NSTEMI. So women, for some reason, are more prone to these kind of mild heart attacks. And what makes it challenging is that women present with atypical symptoms. They don't have this crushing chest pain because they didn't have a full plaque rupture. They have more subtle nausea, shortness of breath, just not feeling well. So, what I encourage women to do from a prevention standpoint is really just plug in early. Like, we don't have to wait for symptoms to develop. Again, we can search for these, like, really categorize your risk, look for any subclinical disease, meaning like catch you way before you ever have a narrowing of an artery or a blockage, and really manage intensely those risk factors. I think women are notoriously like known to be dismissed in the medical system generally, and are also more likely to present with atypical symptoms. So even well-meaning physicians are going to miss some kind of early signs of coronary disease.
Do you think getting a smartwatch or fitness tracker can help with long term heart health? And what ways can we maximize or increase its effectiveness in our fitness journey?
You guys are coming up with good questions here. We're in this era of like collecting so much data and getting like, everybody wants to know like where's these aura rings. I kind of make fun of people that wear aura rings because I just think they're aesthetically kind of dorky. But I would say the things to pay attention to in terms of like what data you're getting are, like, I try to simplify things. The things that I would pay attention to are, what is your heart rate getting to when you're exerting yourself and exercising? The whole purpose of like the whole benefit of cardiovascular exercise is elevating your heart rate. That's what aerobic exercise is. So it doesn't matter if you're rowing, if you're running, if you're doing jumping jacks, if you're getting your heart rate to a target zone, then and you're sustaining it at that target zone for 75 to 150 minutes a week, then you're maximizing your cardiovascular benefit. So I would use your watch to monitor how your like what your heart rate is doing, to know that you're in like what kind of intensity zone you are, and like whether you're achieving or like true aerobic exercise. Those smartwatches are actually also good for monitoring for arrhythmias. So they're very sensitive. They'll pick up a lot of things, and most of it is nothing. But if you're somebody who suffers from atrial fibrillation and it comes and goes, then like using a watch can be helpful with that. I would also say, like, probably sleep quality and sleep duration it's useful to that is useful information from your watch. Sleep is another one of those huge things in terms of like cardiovascular prevention that doesn't get as much recognition as other traditional risk factors, but really getting like high quality and sufficient duration sleep is something worthwhile tracking. So although I hate on the Aura Ring, like you do you, and like if you're getting good sleep, then I'm like really happy for you. And then the other thing is like making targets for step counts. So like just being competitive with yourself, and the step count, like getting tracking your physical activity. I think that can be useful. But then there's all these like minutia about like heart rate variability and heart rate recovery. I don't take as much stock in that. I try to boil things down to the basics, like getting your heart rate up, getting enough sleep.
I was going to say, within the same line of that, for people that don't get that much sleep. How is too much caffeine bad for your heart? And any advice or insight you want to give to caffeine and heart health and stress?
Yeah, so caffeine itself isn't like particular like I think the American Heart Association like put something out there like coffee is actually like a couple cups of coffee is like cardioprotective. I would say the the risks of like pounding coffee is, first of all, you're definitely not getting enough. If you're not getting enough sleep, then that's its own like inflammatory milieu that you want to try to avoid. But also like the stuff that you're putting in the coffee, like if you're or caffeine, like if you're drinking like Celsius, is that what the kids are doing these days? Okay, yeah, I'm seeing. Yeah, so that like I don't know what's in there. Maybe it's healthy, but I would just be like avoid like kind of this like healthy like supplement stuff. Like I just don't know. That feels processed to me, and I don't have like I don't have a randomized clinical trial that shows that Celsius is worse than coffee. I would just say like what the risk is over caffeinating is getting your heart rate up, eliciting like a sympathetic surge, so like getting your blood pressure up. But I would say like as a med student, you got to do what you got to do, man. You got to get through it.
Yeah, I can't even lie. I am the person that takes a cup of coffee in the morning and a Celsius midday. And
Okay.
it's been working for me, but I do try and cut myself cold turkey during breaks. So it's
Oh
not
wow.
too much on my heart.
And I would just say like you can get into a spiral of like bad habits where you're like so tired all day, then you're drinking coffee, and then you're like pounding coffee at night, and then you can't go to sleep. And
Mhm.
so that can, I recommend cutting off coffee like early afternoon should be your latest cup of coffee, just so that you're not getting into any trouble.
What are your opinions on whether or not supplements like magnesium or omega 3s actually help with heart health? Would you recommend people take those daily supplements?
I don't recommend people take those daily supplements generally. The way that I approach it again is like if you're eating a predominantly whole foods, plant focused diet without a lot of processed foods, you're getting all the necessary nutrients and minerals. So that is like the way to get your magnesium. That's the way to get your potassium and to avoid sodium. So like if you're eating a whole food, predominantly plant focused diet, then you don't shouldn't need supplements. Omega 3 fatty acids are have only been shown to be minimally helpful to specifically lower triglycerides in a specific population. And the data on that is even mixed. And this is prescription grade fish oil, so really high concentrations of it. So like the omega 3 fatty acids over the counter, it's really not, it's going to do you absolutely no harm, but it is definitely, it's not going to like save your coronary arteries. So I don't recommend it. I just recommend like eating mostly plants and veggies. And then if you're going to throw in some animal protein, then you would do the lean animal proteins and smaller portions of them, and avoid the processed meats. Again, like I try to keep things like simple without getting too lost in the macros, and the nutrition science is very fraught. The data, it's all on a spectrum of risk. So definitively, when you look at retrospective data, eating processed meats, salami, bacon, hot dogs, sausage, that definitely leads to premature coronary disease and premature death. There's really like little doubt in that. Then adding in red meat, a little bit of risk. There's some kind of physiologic data that shows that it increases this chemical in your body called TMAO, which is associated with atherosclerosis. So there's a physiologic link between red meat and development of atherosclerosis and inflammation. So I would say in general, less red meat is better for you. But if you have a steak once a month or once in a while, I think the marginal harm of that is quite low. And then going further down the spectrum of risk, like the lowest risk meats are the fish and chicken. They're leaner, they have less saturated fat, and by far the healthiest is a more plant focused diet. So again, like what I would boil down my recommendations to is like staying away from the stuff that doesn't look like food, like processed food, staying away from fried foods, and like trying to cook for yourself mostly whole foods with that are like fruits, vegetables, whole grains, legumes, and then a little like some meat here and there is totally fine, and has marginal risk, especially if you're sticking with the chicken and the fish.
I think you did touch upon it a little earlier, but Are there early warning signs that stress is impacting my heart health?
Yeah, I mean, I would say in general, the early warning signs of disruption to your heart health are like if you can't do as much as you used to be able to do. So like essentially when we are like asking the question in the clinical setting, does somebody have heart disease? We put them on a treadmill and we do a stress test. So backing up a step for people that are, walking out, like going through their day and notice like, man, I'm like gassed. Like I just can't get up the stairs as easily, or I was able to play tennis with my buddy a couple months ago and now I feel like he's running like circles around me on the court. Like noticing what your physical exertional tolerance is and taking note of that if there's a precipitous decline, or if you're just noticing more, just less energy, less able to exert yourself, then those are often the signs of like early signs of plaque development in the heart. Certainly if you're having chest discomfort or significant shortness of breath with activity, then that's also, but like the point I'm trying to drive home is that like when we are doing stress tests in the clinical setting, we make people go on a treadmill. So, and like watch how the heart performs. You can be your own kind of judge of how your heart's performing if you're developing symptoms when you're exerting yourself on a daily basis.
On that same line, can you expand on the difference and differentiate between good stress and bad stress when it comes to heart health?
The good stress would be like pushing your heart rate up into a target zone. Anybody can calculate their maximum predicted heart rate. Like the maximum your heart rate should go is 220 minus your age. So I'll round myself up. I'm 40. So my maximum predicted heart rate is 180. So to get into this like aerobic zone or high intensity aerobic zone, you want to be 80%, somewhat about 80% of your maximum predicted heart rate. So that's around ish 140. So when I'm exercising, I want to see that at my heart rate, I'm pushing my heart rate into the about over 140 and sustaining it there for at least 75 minutes a week. But that doesn't just happen overnight. I wouldn't recommend just hopping on a treadmill and jacking up your heart rate. When you're doing this, go slow. So that means like don't push yourself all the way to the high intensity zone. Be in either like just gradually get the heart rate up and sustain it. So like let's say I'm just starting to work out for the first time and my high intensity zone is 140, I would say don't go to 140 right away. Spend a week at around 120 and see how that feels and listen to your body's response to exercise. And then, certainly the bad stress is if you're feeling discomfort, if you're feeling unwell, like afterwards. So like oftentimes that shortness of breath is hard to parse out. Is this because I'm deconditioned or because I'm having actual like cardiac event? If that's hard for you to discern, then I would recommend discussing that with your cardiologist and doing an actual physiologic study where we look at the blood flow and say, all right, you're short of breath, but it's not because there's poor blood flow in the arteries. Go out there and exercise and get like a kind of like a thumbs up, like you're clear to go. And that's often a very useful way to use a stress test to give people the reassurance that their shortness of breath isn't pathologic and you can get out there and push yourself.